It is completely natural to wonder about how doctors find out if stomach cancer has spread and what tools they use to get the clearest picture of your health. Understanding these processes can bring a lot of clarity and peace of mind. Magnetic resonance imaging, often called an MRI, is a powerful medical imaging technique that helps doctors detect the spread of stomach cancer. It uses strong magnetic fields and radio waves to create detailed images of organs and soft tissues inside your body, allowing medical professionals to identify cancer cells that may have moved beyond the stomach to other areas like lymph nodes or distant organs. The core principle behind MRI lies in how different tissues in your body respond to magnetic fields. Your body is largely made of water, and water molecules contain hydrogen atoms. When placed in a powerful magnetic field, these hydrogen atoms align. Then, radio waves are pulsed through the body, temporarily knocking these atoms out of alignment. When the radio waves are turned off, the atoms relax back into alignment, releasing energy signals that are picked up by the MRI scanner. Different tissues, like healthy cells versus cancerous cells, have varying water content and characteristics, causing them to relax at different rates. This difference creates distinct signals that the MRI translates into highly detailed images. Sometimes, a special dye called a contrast agent, often containing gadolinium, is injected into a vein to make cancerous areas even more visible by altering the magnetic properties of tissues where it collects. When you have an MRI scan, you will lie on a movable table that slides into a large tunnel-shaped scanner. It is crucial to remain very still during the scan, which can take a while. The machine makes loud knocking or humming noises, so you might be offered earplugs or headphones to help with this. If a contrast agent is needed, a healthcare professional will administer it through an intravenous line, usually in your arm. After the scan, a radiologist, who is a doctor specializing in medical imaging, carefully examines the hundreds of images produced to look for any abnormalities, changes in tissue structure, or areas that enhance with the contrast agent, which could indicate cancer spread. MRI scans are particularly valuable because they provide excellent soft tissue contrast without using ionizing radiation, unlike CT scans. This allows for superior visualization of complex organs and structures, like the liver, brain, and lymph nodes, which are common sites for stomach cancer to spread. It can also offer functional information, such as diffusion-weighted imaging, which helps assess tissue cellularity and can differentiate between benign and malignant lesions, providing even more insight into the cancer's behavior. Ultimately, the detailed images from an MRI scan are an essential part of staging stomach cancer and guiding treatment plans. By accurately identifying if and where cancer has spread, doctors can make the most informed decisions about your care, tailoring therapies to target the disease effectively and offering the best possible outcomes for your health journey.